This is Lauren Dimitri. I'm the Health Policy Associate at Texans Care for Children. And part of our health policy work at Texans Care for Children, we focused on food insecurity, nutrition, and physical activity because we know that a lack of access to affordable, nutritious food and or physical activity is a major driver of poor health outcomes in our state. So I thought I'd start off with some of the traditional programs we have that safeguard against food insecurity, and the first two bills up relate to school breakfast. The bills differ slightly, but essentially both of them would require schools that have 80% or more of students that are eligible for free and reduced price lunch to offer a universal and free breakfast. The third bill on the slide, we have HB 749 and the companion Senate Bill 759. This bill would attempt to address some of the unique challenges that come along with the summer food program. While the traditional feeding programs with lunch and breakfast are done during the school year, there are some challenges with transportation and with access for children. So this bill would essentially ask the Texas Department of Agriculture to develop a plan to increase participation alongside the Texas Hunger Initiative, which is housed within Baylor University. So on the next slide, wanted to focus, you'll see there's a lot of interest on the part of our lawmakers in the SNAP program, formerly known as the Food Stamp Program. And so you'll see actually the next three slides are going to deal with SNAP-related bills. The first one here, and this is our largest program, it's 100% federally funded. The state of Texas only pays for 50% of the administrative costs. So this first slide is focused on bills that have been filed related to restricting what families can purchase on SNAP. And I wanted to note that at Texans Care for Children, we do have some serious concerns about these bills, as all of them restrict what families could purchase. None of them simultaneously ensure that families with limited access who live in food deserts within Texas simultaneously to have access to what would be allowable. Another thing that's important to note about the SNAP program is that because it is federally funded, the rules and guidelines are set by the United States Department of Agriculture, or USDA. So it's unclear at this time it's clear at this time that even if these bills pass, USDA has indicated that this is not the direction that they would like to go. So I'm not going to point out all of the differences. I'll just note a couple of them. They're very similar, but the first one there, HB 751, actually details foods that would not be allowed to be purchased with SNAP. HB 1101 actually asks for a waiver from USDA to implement guidelines or restrictions, but doesn't define what that would look like. You have HB 523, which is very specific to just eliminating energy drinks from allowable purchases within the SNAP program. And then we have HB 948, which essentially kind of marries the idea of restrictions, so restricting what families can purchase, but also adds in a piece about providing incentives for healthy purchasing, and the bill proposes a 5-year pilot project. On the next slide, you can see these are bills that focus on the flip side, which is creating incentives for healthy purchasing within SNAP. HB 3434 would ask for additional benefits if added to SNAP if nutritious food is purchased. We have HB 1341, which is a very specific wellness education that would be a pilot to Harris County, and to see if there is any impact of having an education course tied to the recipient of the receipt of SNAP benefits. We have HB 3705, which is actually related both to SNAP and WIC, which is the Women, Infant, and Children program that you all might be familiar with. And this is the idea of creating a double dollar program. So essentially, if I purchase produce or a family purchases produce with their benefits, that they get a matching dollar. And the bill proposes that up to a $20 match per month. So then we have HB 3401, which is relating to asking for the the Health and Human Services Commission to develop a wellness and education program that would be tied to the receipt not only of SNAP, but actually also the Medicaid program as well. So on the next slide, and this is the last SNAP slide, we have Senate Bill Senate Bill 879, which is a bill that relates to eligibility, and it's essentially saying that you cannot deny eligible members of a household for SNAP if the head of the household is for some reason ineligible for not completing the work requirements that are tied to the SNAP program. We have HB 1827, which there's been some concern on the part of lawmakers that retailers are advertising unhealthy foods for SNAP recipients, and this bill would take a look at that. We have HB 587, which is the same as Senate Bill 879, but adds that those individuals who have been convicted of a drug felony cannot be disqualified from the SNAP program. Currently, if you at any point in the past have been convicted of a drug felony, you are ineligible for SNAP. And then we have HB 423, which asks that the income, if a family has someone who is ineligible for SNAP, that their income be considered in the eligibility of the other members of the household for SNAP. So on the next slide, we thought we'd talk a little bit about food deserts. As lawmakers are trying to think of ways to address food deserts, there has been a great interest in looking at the retailer side. Are there ways to incentivize retailers to locate and set up shop in food deserts and provide healthy and affordable food? And you can see the first three bills are all different versions of establishing a revolving loan program to meet that goal. You can see the next two bills, HB 1652 and SB 133, deal with the idea of, is there a way to address food deserts by increasing community gardens? And so you have HB 1652, which deals with the liability issues of a private landowner of donating land for the purposes of community gardens, and Senate Bill 133, which deals with underutilized or substantially underutilized state property and a community's ability to apply to use that land for the purposes of community gardens. Okay, on the next slide, there's been a movement throughout the state to increase the availability of homegrown food and food that's local. There's been some unique challenges that have come up for smaller farms, and you can see these are just two issues. One is related to whether or not they qualify for open space land, and then the second one, HB 254, is related to how their wastewater is calculated. Okay, and on the next slide, these are some bills these are what I would call sort of the statewide perspective bills. These are our lawmakers who are attempting to ask agencies and also just stakeholders in general to add their voice to the discussion about how to deal with food insecurity and obesity in Texas. So first up, we have HB 2686 and its companion Senate Bill 1208. And this is really relating to creating a regional food economy task force. This would ask all stakeholders, so small farms, large farms, retailers, state agencies, to look at the issue of improving access to healthy and affordable food in the state of Texas. We have Senate Bill 924, which is asking all of the agencies that sort of touch these issues, so our health agencies, our agriculture agencies, and all of those agencies to develop a strategic plan for how to address hunger, and food, nutrition, and obesity in the state. Oftentimes we think of hunger and obesity as different issues, and what we're really oftentimes talking about are two sides of the same poverty coin. I included on here HB 595. It's a really large bill that includes, that deals with councils and reports of the Department of State Health Services, but I included it because it also repeals the Interagency Obesity Council and asks that those duties be transferred to institutes of higher learning that receive state obesity prevention dollars. You can see on the next slide we have HB 2111. This relates to increasing the nutrition information available to youth in transitional living facilities throughout the state of Texas. We have Senate Bill 1785, which is asking school health advisory councils to take a look at what type of advertising is done on school campuses and whether or not it meets nutritional guidelines. We have Senate Bill 1786, which is attempting to really, some of you may be familiar, the United States Department of Agriculture has recently released proposed guidelines for competitive foods in schools. This bill would attempt to sort of get in front of that and adopt some of those more stringent guidelines and ensure that there are really just nutritious options available during the school day for students. And then you could sort of think of HB 1781 as the opposite of that. That bill is actually asking that there be no sanctions or restrictions put on the type of competitive foods that can be sold during school hours. On the next slide, we have HB 1018. There's an effort underway throughout the state to increase physical activity within schools. This would ask school health advisory councils to include a special fitness planning council to find ways to increase fitness on campus. We have two bills there in the middle. The first one, both dealing with actual PE curriculum. The first one to increase PE in high school back to the 2009 level. It was cut into the 2009 session. The second one would increase, it's HB 277, would increase middle school PE from 4 semesters to all 6. We have Senate Bill 65, which would recognize schools who are doing a good job of implementing coordinated school health. This bill was heard in committee this week and voted out favorably. And then we have House Bill 95, which we always keep an eye on, which you'll see on the next slide why. It would relate to exempting school districts for unfunded mandates, and in unfortunate sort of circumstances, a lot of school health-related initiatives fall in the bucket of unfunded mandates, so we always keep an eye on that. You can see I created a slide here specifically for FitnessGram. I did this because FitnessGram has become kind of a hot topic this session. We have two bills that would make it from a requirement in Texas schools to either optional or completely repealing it. This would essentially, FitnessGram has been in school since 2008. It's currently only conducted in the context of a PE class, and it's the annual fitness assessment that students get about their health that their parents get. Both of these have been heard in committee, and I just did want to note that there is a rider in both the House and Senate budget that would look at providing funding to schools who want to do upgrades to their fitness program. There's a movement from the old traditional system to the web-based system, which is not required, but the rider would allow for them to have funding to do that. On the next slide, we have, if you're familiar with the built environment, when we look at the issue of obesity, we look at the environment that either supports healthy habits or that discourages them. The first bill, HB 1102, and the companion Senate Bill 565, is known as the Complete Streets Bill. This would ask the Texas Department of Transportation to take in the walkability and or bikeability of roads when they build new roads or substantially redo old roads. And the second bill, their HB 258, deals with public land that could potentially be used for physical activity purposes, like, for example, building trails and the liability issues that go along with that. So I saved my favorite topic for last, sugary drinks. One big primary focus of Texans Care for Children is the reduction of sugary drinks. And we focus on this because we know that it is a major driver of calories in kids' diet, and we are somewhat fortunate in the fact that we know how much Texas kids are consuming due to a massive study that was done and published in the journal Pediatrics, which shows that basically a third of Texas kids drink a 2-pound bag of sugar worth of sugary drinks every single week. So every 7 days they drink 2 pounds of sugar. And so we know that in order to address this issue, to address the issue of obesity and also an independent risk factor for type 2 diabetes, we need to get the consumption of sugary drinks down. So you can see there are some different proposals here related to what can be sold in schools during school hours. And the last two bills, you can see there are both a targeted tax on sugary drinks. One distinguishing factor is that HB 779, actually any revenue that's generated from that tax is dedicated to an obesity prevention fund, whereas Senate Bill 493, it would go into GR, or general revenue. But both of the proposals are identical in that they are a penny per ounce tax on sugary drinks, which is what our experts tell us is a high enough tax to decrease consumption in order to get a significant weight loss, but also just incidentally would raise about $1.2 billion in Texas over the biennium, and that's based on Texas-specific data.